Welcome to the Art of Medicine, the program that explores the arts, business, and clinical aspects of the practice of medicine. I'm your host, Dr. Andrew Wilner. And today, our show is a little bit different. Going to feature a company, Actigraft, that makes a wound healing product. And I heard about this, I'm a medical journalist and I follow the news very closely. And I heard a news report that there is an Israeli-based company that works out of Florida that had donated this wound healing product to soldiers and civilians injured in the Ukraine. Hopefully, by the time you're watching this, the war in the Ukraine will be ancient history. But right now, we're recording on April 5th, and it is a big problem for the entire world. So we're going to learn a little bit today from Dr. Robert Snyder and Robert Mueller, the general manager, about where this product came from and what it does. And I was particularly interested because it seems to be a natural kind of healing product. But before we get started, I'd like to thank our sponsor, Comp Health. If you're a physician looking for a new job or considering locum tenens for the first time, check out Comp Health. I've worked locums with Comp Health. I appreciate their personalized experience and a recruiter who is dedicated to my specialty, who knows my needs and goals. Comp Health also offers full-time permanent jobs if you're looking for a longer-term switch. For more information, check out Comp Health. That's comphealth.com. So now, without further ado, I'd like to introduce Dr. Robert Snyder and Robert Mueller. Gentlemen, thanks for joining me.
Thank you for having us. It's a pleasure being here.
The other reason I was interested in this Actigraft was that because I'm a scuba diver, I got interested long time ago in hyperbaric medicine. And it turns out that the hyperbaric chamber that you use to treat the bends for divers is the same chamber that you use for wound healing, because you've got extra oxygen and you get that into the bloodstream and it stimulates healing. And I used to do some wound healing medicine way back when. And then I see there's a new product for wound healing. Of course, non-healing wounds is a big problem, particularly for people with diabetes. And, it's just a nuisance when you've got an ulcer on your foot and it won't go away. And it can be more than that, more than a nuisance if it gets infected and so on. And you guys are the experts. So, Robert Mueller, you're the general manager of the company. Where did this all start?
Yeah, so started in Israel. Dr. Igal Kushner is a family medicine practitioner that kind of struck him one day during his practice about, while healing a patient that had a wound, and the concept of the blood clot and how that acted as a scaffold in this repair or regenerative type solution. It popped in his head. So his son, Alon, who is our CEO, is a clinical researcher, and the two of them partnered together to conduct feasibility to figure out, does it work? Can it be deployed in the field clinically? Is it truly a solution? And they spent several years working through that. And in 2020, we ended up getting Actigraft, which is the product name, FDA and CE cleared to be sold in the US and the international markets. And so since then, we've kind of been on this journey of commercializing and being evangelicals about the product and its benefits.
Dr. Snyder, you use Actigraft in practice. Tell us a little bit about the medical side. What is it? Is it a drug or a device, or how is it different than all the other stuff?
It's different in a number of ways. Number one, it is autologous. So it is a point of care therapy where we're basically drawing blood from a patient. We're creating a clot with the calcium gluconate and kaolin. We're putting it in a little dome, letting it sit there for a short period of time, probably about 8 minutes for the the clot to actually be formed. And then we basically just take the entire clot and we place it directly onto the wound. And what is happening is a multiplicity of things. First and foremost, it creates a scaffold, so it replaces the largest element of the skin, which unfortunately becomes destroyed when a patient has a wound, and that's the extracellular matrix. So it basically is a plug, if you will, to supplant that extracellular matrix, which is missing. It also allows cells from surrounding the wound to move across the wound. So it actually acts as a scaffold to re-epithelialize or heal the wound. But just as importantly, or maybe more importantly, it's full of cytokines or growth factors. These are elements that basically create a dynamic where it draws other cells from other areas of the body to come and help heal the wound itself. So it bathes the area with the body's own growth factors. So between that and the substrates and the fact that it does act as this scaffold, it creates a very, very important or multiple elements to support healing. It's also autologous. So it's very different from what we see in the field ordinarily, which are the allografts. These are products and therapies that come from other humans, but they're not from the patient themselves. And of course, that could have a downside. There could be transmission of disease and rejection, et cetera. I mean, it's not common, but it certainly can happen. When you're dealing with an autologous product, you're dealing with a product that comes directly from the patient. So all of those risk factors go away. Additionally, when the patient comes to the clinic and the wound is prepared to accept something like this, if it's clean, if it's been appropriately debrided or cleaned up, if we feel that it is ready to accept this product, then we can draw the blood right at that time and apply the product. If you have to order a product, as an example, and wait for the patient to come in, the patient may not come. The patient may have an infection. The patient may have a wound that's already healed, and now you have a product that you need a home for. So this is really used at the point of care, and that makes it extraordinarily unique.
Well, I watched the videos on your website, and it was pretty impressive. You draw the patient's blood, and then you squirt it into the little mold, and then it clots, and it makes this little hockey puck.
Correct.
And then I put that over the hole. And I guess that lasts about a week or so. Is that right? And
So we
helps.
normally leave it on for a week. Certainly the patient can be checked maybe once during that week's time, either by a nurse or a family member, just to let us know whether or not the patient is doing well. By the end of that week, when the dressing is removed, that clot has already been dissolved or resorbed. Any extra clot that's been around the wound is basically kind of almost like a scab, and it comes off just by wiping it with saline. And what we normally do is we apply another clot at that point. So these are usually applied once per week. And we start to see a pretty dramatic change usually by the second or third week.
Mr. Mueller, what is the connection with the Ukraine?
So, we kind of had a internal discussion around, is there anything that we can do to support Ukraine and the humanitarian crisis that was going on there? And there were a big support from the internal team. Everybody in the company wanted to do something. And we spent some time trying to figure out, well, how do you get a product to a war zone? How do you train folks to make sure that they know how to use it? And then lastly, make sure it gets into the right hands to deploy it. So it took us a couple of weeks to kind of organize the team to figure out how to make it all come together. And last week we ended up shipping the pallet of inventory over, and with our partner distributor in Ukraine, to coordinate with some KOLs or some physicians in the hospitals there locally to get them up and running. And so they're using it now. We've had a lot of support come out from the community wanting to help us get another shipment into Ukraine. So we're working on hopefully trying to coordinate that and hopefully get some stories back out of healing some of these wounds and helping the Ukrainian folks.
Now, can the product be used on the battlefield for an acute wound, or is it for later after the body's had a chance to sort of get the healing started and then it facilitates sort of the long-term process. Where does the product when is it applied?
I think it can be applied in an acute or a chronic wound scenario. It hasn't been studied extensively for acute wounds, but certainly what you're doing at the very least, the blood itself has cells in it called macrophages, and macrophages will help kind of phagocytize or gobble up the bacteria. So we feel that it will lower the bioburden. So there's a very strong likelihood that it will lower the patient's risk of infection, particularly when they're on the battlefield. And in answer to your question, at least from my point of view, this is something that could be done anywhere that you can draw blood. So if you can draw blood in an area, whether it be on a battlefield, whether it be in a field hospital, or whether it be, in a more sophisticated facility, it's certainly something that you could do anywhere because it is a point of contact, a point of care. And people are very used to and very comfortable with the process of having their blood drawn. So it isn't anything that's frightening to them or uncomfortable in any way. And it becomes a very pleasant process. And also when the patient has it on their body, it's usually a very comfortable dressing. One thing that we have noticed in individuals that originally come to us with painful wounds is that when we use the product, it mitigates the pain to a significant extent. And very often that occurs over a very short period of time. So at times, I've had situations where patients have come into the office with pain. We apply this therapy, and when the patient leaves, they express the fact that they don't have pain in the area anymore. So I think that that's another important element. One other thing I would mention, obviously, this has been studied extensively on diabetic patients. Obviously, they're the most at risk for limb loss. There are 200,000 amputations in diabetic patients, non-traumatic amputations performed on diabetic patients in the United States. And obviously, it's a very daunting problem, and can lead to some very, very significant scenarios, depression, and ultimately patients who lose a limb very often succumb to their illness and die within 3 to 5 years. So it's very important that we use these products, a product like this in a patient with diabetes. But what we have found is not only is it useful for the more superficial wounds, but we're also using it in patients that have vital structures exposed, like bone, tendon, and muscle. These certainly create a greater risk for patients to develop infections, and ultimately that could lead to sepsis, limb loss, and death. So it becomes very, very useful in that regard as well. But we are using it in a lot of other areas. We're using it in venous leg ulcer patients, in trauma patients, and patients with pressure ulcers. We're using it in a flowable form where you can actually inject the blood product underneath an undermined area in a wound or in an area that may be difficult to get to. And it conforms very nicely in that area. And there's some ongoing research in that regard as well.
Now, I work at Regional One Health here in Memphis, and we have a pretty busy trauma center and also a burn center. Now, you mentioned it can be used in trauma. What about burns? Does it help cover the skin and help healing in that scenario?
So to my knowledge, it hasn't actually been studied in burn patients to any great extent, but my feeling is, just based on my understanding of the science, that it certainly could have a positive effect, not only on healing, but also, as you know, pain is part and parcel of individuals who have burns. And at least in my mind, I feel that this would likely be an imperative in that regard as well, where this could conceivably decrease the amount of pain. And again, it's kept in place for an extended period of time. So it's not like you're using a topical agent and every single time you have to apply it, there is pain not only in removing the old dressing, but now applying a new one. So this also gives us an opportunity to use a dressing for an extended period of time that would not be, would not cause a painful scenario.
Yeah. The one thing I'd add to that is burns is currently off-label or are not indicated for us at this point in time, but we have had several folks report that they've used it in that manner and it's worked. So we're looking at expanding on that as we go forward as well.
Yeah, that's great. Now, we talked earlier about hyperbaric medicine, which is often used for non-healing wounds. Can this product be used in conjunction with hyperbaric medicine?
Again, it's not something that's been studied extensively. My sense is yes, as long as you're not using some kind of petrolatum covering, anything that could conceivably ignite. We haven't really used it in hyperbaric patients, to my knowledge. Maybe Rob, you can expand on that. But I mean, I think it could have a place, but just hasn't been studied. So I really couldn't comment right now as to how that could be utilized. But I do envision that if it could, then it certainly could be extremely beneficial because, as you know, hyperbaric oxygen not only brings oxygen to the area, but also uploads receptor sites, and receptor sites on the cells can grab onto those cytokines, which are seen in very large quantities in the blood product. So this certainly could synergize the opportunity for us.
Right, that was my thought. So after a week or so, does the prod is it all resorbed? Is it gone, or do you have to wash it out and put a new one on, or what
It's pretty
happens?
much gone. It's pretty much gone at the end of the week. When I first started using it, it kind of goes on, and as to your point, it looks kind of like a hockey puck. It's very malleable. It looks like a hockey puck. And when you put it on, particularly a heel wound, which when a person steps down is 40 psi's of pressure, I had concerns that the clot would just kind of splat and would go away. As it turned out, it did not. And additionally, I was concerned about the fact that perhaps it would create a lot of moisture around the wound. And what I found very interestingly is when I opened up the dressing for the first time, I noticed there was a little hole in the clot itself, whatever was remaining. And whatever drainage that had occurred, it actually had an egress out of the area, so that when the wound was actually observed after the clot had been utilized for a week, there was no maceration, no super wetness around the wound at all. And in fact, the wound had been dramatically improved by that point.
Well, I think it's pretty cool. A long, long time ago, we used to use leeches, right, to take the patient's own blood out and make the patient better. And then, of
Correct.
course, somebody came up with transfusions where we take the patient's own blood out and either give it to someone else or give it back to the patient, after surgery or later. So you have a lineage here. So here's another example of using the patient's own blood and taking it out and then giving it back to them, and applying it and letting the body really heal itself. I think that's
Correct.
philosophically, anyway, it's very satisfying. And I know it proved successful in your studies, and you're using it now around the world. If somebody wanted to use this in their practice, is it available to them?
It is available. We're both FDA and CE cleared. So in the US, we have a sales force here that services accounts, and we're distributing in about 45 different countries across the world today, and continuing to expand that. Folks could find information on how to reach us at www.reddressmedical.com. So that's probably the best way to reach
All right, I'll
us.
put that in the show notes. And that's the parent company, Reddress
Yeah,
Medical.
that's the company name, Reddress Medical. And then the product is Actigraft.
Well, Dr. Robert Snyder and Robert Mueller, I'd like to thank you very much for explaining Actigraft and joining me on the art of medicine.
Pleasure was ours. Thank you very much for
Thank
having
you.
us.
Well, wasn't that an interesting discussion? Many thanks to Actigraft, Dr. Robert Snyder and Robert Mueller, for telling us all about this novel way of helping wounds heal. Now, before we close, I'd like to give thanks once again to our sponsor, Comp Health. At Comp Health, you can talk with a recruiter who knows your specialty and will actually get to know you and your goals. Consider starting your personalized job search at Comp Health. That's comphealth.com. Thanks for watching. See you next time. This program is hosted, edited, and produced by Andrew Wilner, MD, FACP, FAAN. Guests receive no financial compensation for their appearance on the art of medicine. Andrew Wilner, MD, is Associate Professor of Neurology at the University of Tennessee Health Science Center, Memphis, Tennessee. Views, thoughts, and opinions expressed on this program belong solely to Dr. Wilner and his guests and not necessarily to their employers, organizations, or other group or individual. While this program intends to be informative, it is meant for entertainment purposes only. The Art of Medicine does not offer professional financial, legal, or medical advice. Dr. Wilner and his guests assume no responsibility or liability for any damages, financial or otherwise, that arise in connection with consuming this program's content. Thanks for watching. For more episodes of The Art of Medicine, please subscribe. www.andrewwilner.com